Hello, my name is Dr. Namrata Agrawal and I am an ICU specialist at Borivali Healthcare. Today, I want to talk about a life-threatening emergency that requires immediate critical care: severe blood loss, also known as hemorrhagic shock. Blood is responsible for carrying oxygen to every organ in the body. When a person loses a large amount of blood, the body cannot deliver enough oxygen to vital organs like brain, heart, and kidneys. This condition is called shock, and without urgent treatment, it can rapidly become fatal. Severe blood loss can happen after road traffic accidents, major fall, stab or gunshot injuries, or even internal conditions like ruptured ectopic pregnancy, gastrointestinal bleeding, or internal organ injury. Sometimes bleeding is visible, but in many cases, especially internal bleedings, there may be no obvious external signs. Early symptoms of severe blood loss include weakness, dizziness, restlessness, pale or cold skin, sweating, and a fast heartbeat. As blood loss continues, blood pressure drops, the patient may become confused or drowsy and eventually unconscious. This is a medical emergency that requires immediate ICU care. When such a patient arrives, the ICU and emergency team work simultaneously on multiple life-saving steps. The first priority is to secure the airway and ensure proper breathing. Oxygen is given immediately, and some patients may need a ventilator if their condition is critical. At the same time, we insert large IV lines to rapidly give fluids and blood transfusions. Replacing lost blood is essential to restore circulation and oxygen delivery to organs. We closely monitor blood pressure, heart rate, urine output, and oxygen levels to assess how well the body is responding. But giving fluids and blood is not enough. We must urgently identify where the bleeding is coming from. This may involve emergency scans, ultrasound, or immediate surgery. Trauma surgeons, general surgeons, or other specialists may need to operate to stop internal bleeding. While this is happening, the ICU team supports organs that may be affected by shock. Kidneys may temporarily stop producing urine, lungs may struggle due to fluid shift, and the heart may weaken. Advanced monitoring and medications help stabilize these organs. One of the dangers of severe blood loss is that even after bleeding is controlled, the body can develop complications like clotting problems, infections, or organ failure. That is why ICU monitoring continues even after surgery or initial stabilization. The faster treatment begins, the better the chances of survival. Delays can lead to irreversible organ damage. That is why anyone with major trauma, signs of internal bleeding like severe abdominal pain, vomiting blood, black stools, or sudden collapse should be rushed to the hospital immediately. Severe blood loss is terrifying, but with rapid emergency care and ICU support, many lives can be saved. Early recognition, quick transport, and specialized ICU care makes all the difference. If you found this information helpful, please like, share, and subscribe to our channel. Spreading awareness about emergency conditions can truly help save lives.